Systemic lupus erythematosus and rheumatoid arthritis are immune-mediated inflammatory diseases that manifest predominantly with symptoms and signs of musculoskeletal and mucocutaneous inflammation. They frequently cause cardiovascular disease, which is associated with a substantial morbidity and mortality rate. RA is a chronic progressive systemic disease mostly damaging joints. Unfortunately, it can also cause damage to the heart, kidneys, and eyes. RA affects people of all ages, more often women. Exact causes of rheumatoid arthritis are still unknown. RA is considered to be caused by genetic factors and viruses. Essence of the disease is dysfunction of the immunity. Immune cells accumulate in the joints, bones, cartilage, and surrounding tissues, and cause chronic inflammation. The inflammation causes destruction and scarring of the joints. Later, the joints deform and lose their structure. The hallmark symptoms of RA is morning stiffness that lasts for at least an hour. Swelling and pain in the joints must occur for at least 6 weeks before a diagnosis of RA is even considered. The inflamed joints are usually swollen and often feel warm or boggy, spongy when touched. The pain often occurs symmetrically on the body, but may be more severe on one side of the body. Although RA almost always develops in the wrists and knuckles, the knees and joints of the ball of the foot are often affected as well. Many joints may eventually be involved, including those of the cervical spine, shoulders, elbows, temporomandibular joint, and even the joints of the very small bones in the inner ear. In some patients with RA, inflammation of small blood vessels can cause nodules under the skin. They're about the size of a pea or slightly larger and are often located near the elbow. Although they can show up anywhere, symptoms such as fatigue, weight loss, and low-grade fever may also be present. Researchers emphasize that RA patients must recognize that they have a higher risk for heart disease. Interestingly, however, rheumatoid arthritis patients are much less likely to complain of chest pain due to painkiller medications, allowing for the first evidence of heart disease to occur as sudden cardiac death. X-rays generally have not been helpful to detect the presence of early rheumatoid arthritis because they cannot show images of soft tissue. The doctor will order an ultrasound or MRI. For cases when heart disease has occurred due to RA, the neck ultrasound could be effective in detecting coronary artery disease. The simple, inexpensive, and non-invasive carotid artery ultrasound of the neck may be an alternative to the standard expensive and more invasive coronary angiography. Because RA is a systemic disease, more than your joints are at risk. Coronary artery disease, CAD, affects more than 16 million Americans, making it the most common form of heart disease. CAD and its complications like arrhythmia, angina pectoris, and heart attack are the leading causes of death in the U.S. CAD most often results from a condition known as atherosclerosis, which happens when a waxy substance forms inside the arteries that supply blood to your heart. This substance, called plaque, is made of cholesterol, fatty compounds, calcium, and a blood-clotting material called fibrin. Atherosclerosis tends to occur more often and advances more rapidly in SLE and RA patients than the general population. The disease starts when the very inner lining of the artery, the endothelium, is damaged. High blood pressure and high levels of cholesterol and triglycerides in the blood and smoking are believed to lead to the development of plaque. Studies show that people with rheumatoid arthritis are more likely to die from heart disease than that of the general public. Systemic lupus. Lupus is an autoimmune disease characterized by acute and chronic inflammation of various tissues of the body. Autoimmune diseases are illnesses that occur when the body's tissues are attacked by their own immune system. Common complaints of SLE and symptoms include muscle aches, arthritis, which can sometimes mimic that of rheumatoid arthritis, ulcers of the mouth and nose, a facial rash, which is characterized by a flat facial rash over the bridge of the nose, and because of its shape, it is frequently referred to as the butterfly rash. Also, they experience sensitivity to sunlight, inflammation of the lining that surrounds the lungs called pleuritis, and that of the heart, which is called pericarditis, causing sharp chest pain. The chest pain is aggravated by coughing, deep breathing, and certain changes in body position. It has also been shown that women with SLE have a significantly increased risk of heart attacks due to coronary artery disease. Some people with SLE have Raynaud's phenomenon. Other conditions that can accompany lupus include fibromyalgia, non-bacterial valvular heart disease, pancreatitis, esophagus disease with difficulty of swallowing called dysphagia, liver disease known as Lupus hepatitis, and infections can occur. Patients with SLE need more rest during the periods of active disease. Physicians emphasize to patients that sleep quality and the effects of underlying depression, lack of exercise, and self-care coping strategies affect the overall health. During these periods, carefully prescribed exercise is still important to maintain muscle tone and a range of motion in the joints for systemic lupus patients. The immune system is a complex system within the body that is designed to fight infectious agents, such as bacteria and other foreign microbes. One of the ways that the immune system fights infections is by producing antibodies that bind to the microbes. People with lupus produce abnormal antibodies in their blood that target tissues within their own body rather than foreign infectious agents. Because the antibodies and accompanying cells of inflammation can affect tissues anywhere in the body, lupus has the potential to affect a variety of areas. Sometimes lupus can cause disease of the skin, heart, lungs, kidneys, joints, and/or nervous system. The precise reason for the abnormal autoimmunity that causes lupus is not known. Inherited genes, viruses, ultraviolet light, and certain medications may all play some role. Let's now take a look at how systemic lupus erythematosus affects the heart. A person with SLE may have inflammation of various parts of the heart, such as pericarditis, endocarditis, and myocarditis. The endocarditis of SLE is characteristically non-infective Liebman-Sachs endocarditis and involves either the mitral valve or the tricuspid valve. It's one of the most common cardiac manifestations of lupus, the most common being pericarditis. The vegetations are small and form from strands of fibrin, neutrophils, lymphocytes, and histiocytes. The mitral valve is typically affected, and the vegetations occur on the ventricular and atrial surface of the valve. Liebman-Sachs lesions rarely produce significant valve dysfunction, and the lesions only rarely embolize. The vegetations are cauliflower-like or flat, red, spreading masses of more than 2 millimeters in diameter, more commonly located on the leaflet's closure lines. The predominant functional abnormality is regurgitation. Stenosis is rare. In pericarditis, the most common way that lupus affects the heart is through inflammation of the pericardium, the sac that surrounds your heart. Inflammation of the pericardium is called pericarditis. The symptoms of pericarditis are sharp positional chest pain and dyspnea. In people who also have a large or loculated pericardial effusions in association with pericarditis, pericardial drainage may be necessary. For SLE patients, pericarditis is typically treated with anti-inflammatory drugs. Failing that, a brief course of corticosteroid treatment is usually necessary. Myocarditis is caused by inflammation of the myocardium, the muscle tissue of your heart. Fortunately, it is uncommon in lupus. The symptoms are chest pain and unexplained rapid or irregular heartbeat. Myocarditis is often seen when there is inflammation of other muscles in the body. Because a definitive diagnosis requires a heart biopsy, doctors are reluctant to perform this because they are invasive. However, myocarditis can be caused by viral, bacterial, and fungal infections. Because lupus itself creates an added risk for developing infections, especially if the patient is taking certain immunosuppressive drugs, then patients with SLE are at increased risk for myocarditis. The diagnosis and prognosis of systemic lupus and rheumatoid arthritis. To help prevent heart disease, a diet filled with fruits and vegetables, whole grains, legumes, and monounsaturated fats such as olive oil is essential. fish rich in omega-3 fatty acids, such as salmon, decrease inflammation, and flavonoid foods rich in dark chocolate, blueberries, green, and black teas are heart-healthy foods which may inhibit the buildup of plaque in the artery walls and actually prevent blood clots that can trigger a heart attack or stroke. A vegan diet is recommended, and mild alcohol consumption is recommended for patients with SLE and RA to help lessen the symptoms by decreasing their immune system. People with SLE can prevent flares of the disease by avoiding sun exposure and not abruptly discontinuing medications, and constantly monitoring their condition with their doctor. It's your body, it's your life. You're in control.